As you know, October is Breast Cancer Awareness Month. Here in Oklahoma, there's now a new way to remove cancerous tumors from the breast after a cancer diagnosis. Dr. Clint Merritt is the Director of Breast Surgery for Hillcrest, and he joins us this morning to talk about this new tool in the fight against breast cancer. Great to meet you.
Nice
Thanks
to
for
meet
coming
you. Thank you.
Talk to us a little bit about, as a breast cancer survivor myself, this is a very traumatic diagnosis and all the different steps that have to happen. I come in, there's a lump. I get the diagnosis, I have breast cancer. What's that next step look like, and how does this tool play a part in that?
Sure, yeah. So usually the first step for a cancer diagnosis, as you said, is getting the diagnosis. And most of the time that's done through what's called a needle core biopsy. A small needle is guided usually either through an ultrasound device or a mammogram device into the area of concern in the breast. A tissue sample is taken, it goes to a lab, in about 3 to 5 days we get a result back. Is it cancer or is it not? Once that diagnosis is made, then the treatment planning begins. And so for most patients in early stage breast cancer, surgery is going to play a role in their treatment. And so identifying the area of breast tissue that needs to come out is very important, and preserving as much healthy breast tissue at the time of surgery in the setting of a lumpectomy type of case, which is where we preserve healthy breast tissue, take out the cancer. Keeping as much of that healthy breast tissue is paramount for cosmetic result. And so that's where Molly, the new Molly device, comes in. It's a new surgical technology that allows us to preserve as much healthy breast tissue during a cancer operation as possible, but at the same time getting out the area of concern very accurately and precisely.
So before Molly came along, how did you do that?
Yeah, so the historical way was through what's called wire localization, and its name implies exactly as it is. A woman or a man could come into the operating room, but before that, they would have to go to the radiology department. The radiologist would actually insert a very thin wire through the breast skin into the breast tissue and into the cancer site. And that wire would actually stick out of the breast, and then the patient would be wheeled from the radiology department over to the operating room with that wire sticking out of the breast. The surgeon would then follow that wire down to the area of cancer and take out the area of cancer. So obviously that's emotionally traumatic for a patient, right?
Right.
You don't want a wire sticking out of your breast, and looking down and seeing that can be obviously disturbing for a patient. And so the trend nationally and worldwide was we got to get away from this technology. Wire localization still has some uses in today's breast surgery world, but for the most part the transition has been to wireless localization technology, which is one of the devices we're going to talk about today.
So instead of the wire,
right,
this is placed in there. Tell us about this. You can barely see, it's super, super tiny, that little bit of gold in the center. Yeah,
it's a 3mm gold-plated chip, if you will. It's magnetic base, so it's very safe to put in, not going to hurt the patient at all. It's inserted through a small needle. At the time of the initial breast cancer biopsy, it's standard of care to put a marking clip into the cancer. We do this because we want to know where the cancer is. And so once that marking clip is there, we need something smarter in the operating room to tell the surgeon where is the breast cancer at the time of surgery. You know, when I make an incision and then I'm following down in the breast tissue into the area of cancer, I got to know where is it.
Yeah, because it could be anywhere.
It could. And so that's where this comes in. So this small 3mm device called Molly transmits a signal in the operating room to this iPad-like device, and it gives us not only a directional capability, but also a distance capability. And so, and we'll demonstrate that here in a moment.
And that's really cool. Okay, so we have basically would be the breast tissue.
Correct.
And inside there is that little magnet.
Absolutely, yeah.
And then you have a wand. Go ahead and show how that works.
So this is called the Molly wand, and I don't know if you can see it, but inside here is the 3mm gold microchip, if you will. And as the surgeon, get closer to the area of cancer, it's going to start generating a noise and a signal. And you'll notice there's a green dot in the middle, and that's telling me as the surgeon that I'm in direct alignment with the area of cancer. And then as I get closer, you can notice that distance up top also decreases. And so what this does is it allows me as the surgeon to get within 1 millimeter of accuracy of the cancer area, and that allows me to have an accurate margin, if you will, getting around the cancer, but giving an excellent cosmetic result to the patient at the same time.
For sure. Is this for every breast patient?
You know, there are some contraindications to placement, particularly patients with pacemaking devices may not be eligible for placement of this. It is FDA cleared for soft tissue placement only at this time. It was FDA approved in 2021. We're the first in Oklahoma to use version 2 of the device, which was released in April of this year. At Hillcrest, we started using it a month after release in May, and we've done over 100 patients at this time, and they love it. It's convenient for them, it's safe, effective, and the patient feedback has been amazing.
And as a surgeon, it just gives you a little bit more confidence.
Oh, for sure. Yeah, you know, we want to give the best results, not only cancer operation-wise, but cosmetic-wise. You know, breast cancer surgery is a blend of good cancer results, but great cosmetic results at the same time. A good surgeon should have both of those in their mind at all times. And that's where this device really helps, is because it gets me both of those results.
That's great. Great to meet you.
Thank you.
Thank you for coming in. And patients out there, just be aware that Molly can be on your side
Yes.
while you're going through this.
Thank you.
Appreciate it.